assistant professor in the Department of Psychiatry and an associate director of the Center for Imaging Research. I study brain dysfunction through the use of magnetic resonance imaging. Predominantly I use functional magnetic resonance imaging, so I study cognitive processes that are related to brain dysfunction. And some of the disorders that I work on include drug abuse, a little bit of work in bipolar disorder, and we examine how the brain functions or fails to function properly in these disorders. In the drug abuse population, we actually recruit recreational drug users from the Cincinnati area and run them in the MRI system. And we also simultaneously record EEG from their brains using electroencephalography technique. And then we're able to examine the similarities or differences between the functional MRI signal and the electroencephalography signal to see if there are things that we can learn from the combination of the two techniques that might differ from what we learn from either one technique alone. This allows us to do what we call multimodal imaging and to see the dynamics of brain activity in ways that are not available to either MRI alone or EEG alone. And so we study these kinds of things in drug abuse populations, and we also look at bipolar disorder, where we're interested to know if there are predictors of treatment response or markers of treatment outcome that we can use to understand better how people's brains change with the success or failure of treatment for these mood disorders. So if you're interested in participating in an MRI study, please get in touch with me, or if you're just interested in the program, you can find my information on the UC Neurosciences website. Thanks.